Okay, so for a brief discussion of who are the key players in global health, you might have recognized some of those pictures or logos. Those are some of the bigger organizations. So we're going to go from the biggest ones down to the smallest ones. Who are the key players? Well, first we have the United Nations programs. The United Nations administers a lot of global healthcare planning. The biggest organization of which is the World Health Organization. It is the biggest, most well funded organization. It attracts the highest levels of expertise. Um, we also have UNICEF. UNICEF is a little bit more narrow in focus. They only tackle a few high prevalence problems. They don't address as many issues as World Health Organization, but they do manage to provide a lot of assistance. We have United Nations Fund for Population, UNFPA, and that provides access to family planning services across the globe, which is very important for promoting health. We have the United Nations Development Program, which helps nations with lower resources to develop their economies, to become financially a little and technologically a little more developed. And we have the World Bank. The World Bank is in charge. It's actually a collection of 5 financial institutions that decide how to raise funds and allocate them to countries who are in need of assistance. And just a few words about the World Health Organization. It does a lot of good. It attracts a lot of expertise. There's a lot of good research and distribution of knowledge through the World Health Organization. But they have been criticized for a few things. Number one, a lot of their goals and statements are a bit vague and more difficult to put into practice. They're a little weak on the programming aspect. They're sort of those big visionary thinkers that we talked about. They're really not into the boots on the ground thing. They are very, very costly to run. There's high overhead. They have expensive facilities in Geneva, Switzerland. They pay higher salaries, and they're very rigidly prescribed in what they can and cannot do. So those are some of the drawbacks of the World Health Organization. Some advantages to having this huge organization made up from every nation on the planet is that they're able to have access to all of the ministries of health around the world. They tend to be accepted in every country because every country has participation and shares in governance. Um, and they have a lot of impact. They do centralize a lot of the knowledge, and a lot of capabilities and knowledge are exchanged in the World Health Organization. So it is the premier organization for global health. World Bank finances things. There are some things about the World Bank that have been criticized as well. For example, they tend to favor decision making to the wealthier nations, and that's not necessarily in the best interests of global health. So, United States has the highest voting privilege. We have 15% of the vote. However, we only give a tiny bit of our gross domestic product when compared to other nations, and I have that coming up for you in a minute. There we go. Bilateral government associations or donor recipient partnerships. These are agreements between two countries, a donor country and a recipient country. So, USAID is the one for the United States. It provides the least aid to nations in need of all of the wealthier nations. We contribute 0.10% of our GDP. Compare that with like Denmark, that contributes 0.93%. They just have lower overall GDP, but as a percentage, they give more. Now, USAID gives aid to countries who are considered allies, probably a little more than they give aid to countries that are not considered to be our allies. And that is also a problem. There are some political motivations in the giving of financial aid to countries in need. We also sponsor the Peace Corps in this country, and that is made up of volunteers. And that works a little bit more like an NGO, just with government support, where you get the boots on the ground people where they're needed, providing care and assistance. Other countries also have these bilateral associations and sponsor their own relief efforts. Australia, Canada, Denmark, Finland, France, Germany, Italy, Japan, New Zealand, Sweden, United Kingdom. There are some countries that are considered a little bit wealthier who are not on this list. And then there are many countries that are in the recipient list. If you remember, back to that little quiz in the beginning, like how many countries do you know? You get like 15 minutes to name them all. Um, there are 193 countries, but it's only this handful that's actually supporting most of the global health effort. Non governmental organizations, you're probably familiar with the term NGO. These organizations are not affiliated with the governments of any nation. They're usually startups that people do out of altruism. We have foundations, like the Bill and Melinda Gates Foundation or the Carnegie Foundation is another one. And these foundations provide grant money. They don't actually implement the projects themselves. They provide grant funding to more grassroots organizations that want to implement a project. We have secular private organizations that do about the same thing, but they do some of the relief effort themselves. They raise funds and they actually do some of that programming. Faith-based organizations, very similar, like Catholic Relief Services and others. And we have some private organizations that do a lot of global health work. For example, pharmaceutical companies like Merck donate vaccines and other medication to countries that need access to those things. And then last, we have contracting agencies. These are really for profit. And what they do is they identify a need and then they contract with other organizations to provide that need. Now, some of the advantages of an NGO are they're not tied to rigid policies because they're making their own constitution and bylaws. And it's more of a grassroots feeling. A lot of times there's more community partnership, there's more cultural sensitivity. There's no politics per se going on. You're not sort of giving preferential treatment to one nation because they're supplying you with something. It's really altruistic. And most people that work for an NGO don't feel that this is a job. They feel that it's a calling. They're very passionate and committed about their work. Some of the downfalls of non-governmental organizations are that the smaller ones tend to be very poorly funded. They don't always attract the best and the brightest technical experts. Most of the time it's younger, inexperienced people who will join an NGO before they've developed that technical expertise. So that can happen. It's not universally true. Lots of experienced providers do volunteer, but they have to do it in smaller increments of time. So they don't always give that long-term commitment to projects. Other problems with non-governmental organizations are that sometimes they'll pilot a project in a small area and they are wildly successful at it. They implement some kind of solar oven and that sterilizes medical supplies and it works great in one community because that's all they had the funding for. And because they're not part of a larger organization like the World Health Organization, that intervention works at that time in that place, and then it doesn't become part of our global health paradigm. It's not a universal thing, and that's a problem. And that happens in the United States as well. Sometimes you'll have, initiatives. A hospital system will decide to implement a bundle of interventions, and they're successful at it, but without some kind of overarching regulation that sort of mandates that across the board, you really don't see the gains that you could. And people are left to the accident of their birth and the best intentions of these NGOs. So other complaints that have been leveled against NGOs, some of them, particularly more faith-based organizations, have been accused of colonialism, where they're trying to impose the dominant belief system or culture on the community that they serve. I think historically that was more true than it is today, although, there is still a fair amount of preaching that goes with the assistance that people are given. Those are NGOs. Now we're going to just kind of flesh out that concept of colonialism in a global health context. And I want you to ask yourself, go on the World Health Organization website if you want to, and look at any graph, map, anything comparing health disparities. Why do they all look like a map of the colonial territories from like 1600s? And it's because colonialism left its mark on those nations, put their people at a disadvantage, imposed systemic racism on them, and they're still breaking the bonds of those things. So let's talk a little bit about what that word means, colonialism, when it comes to that. It talks about an expression of the domination of one culture over another. And when it comes to health policy, when you have the richest nations in the world voting in the World Bank and having more of a say about where the money goes and what it goes for, there's that risk that you're going to colonize people all over again in an inequitable, unjust healthcare system. Um, the problem emerges a lot of times. We have this Western understanding of disease and medicine, and we rely a lot on high tech, expensive solutions to healthcare problems and less on prevention and health maintenance or promotion. So, the solutions that Western countries sometimes come up with look like these high tech solutions, only the resources, the money isn't there to provide them. So, what the recipient nations get a lot of times are these stripped down, bare bones version of Western healthcare, machines that are old and obsolete, and there's not enough of them. They might get equipment that's expired. Um, it's really second rate care. And if we were to put more emphasis on prevention and on allowing traditional healthcare providers to practice with support, um, that could look a lot different. But because the World Health Organization and other big organizations are only asking physicians, and they're only asking Western physicians, we get this watered down version of Western healthcare, which, in the United States really isn't the best healthcare model. Um, so just be mindful of that as we move along and as you're considering solutions to global health problems as well. All right, we're going to drop off there and pick up in a few minutes. So feel free to take a break.